Hello and welcome, medical students. Today, we will delve into the fascinating world of pharmacology and explore the intricate mechanisms and complexities of the blood-brain barrier, BBB, and its importance in drug transport to the central nervous system, CNS. The BBB is a highly specialized structure that separates the CNS from the circulating blood and plays a crucial role in maintaining homeostasis within the brain environment. The BBB is composed of tightly regulated endothelial cells that form a physical barrier and restrict the entry of various substances into the brain. These endothelial cells are interconnected by tight junctions, limiting the paracellular transport of molecules. Additionally, specialized transporter proteins on the endothelial cell membrane facilitate the selective transport of essential nutrients and therapeutic drugs across the BBB. Understanding these mechanisms is crucial for the development of effective CNS drug therapies. Neuroinflammation, a common phenomenon in various neurological disorders, can lead to BBB dysfunction. Inflammatory mediators, such as cytokines and chemokines, disrupt the tight junctions and alter the expression of specific transporters, compromising the integrity of the BBB. This dysfunction allows the infiltration of immune cells and potentially harmful substances into the brain, contributing to the pathology of neurodegenerative diseases. The ability of drugs to cross the BBB is influenced by their physicochemical properties. Lipinski's rule of 5 is often used to predict a drug's ability to penetrate the BBB, considering factors such as molecular weight, lipophilicity, and hydrogen bonding capacity. Understanding these properties can aid in the design of CNS active drugs with enhanced permeation capabilities. Efflux transporters, such as P-glycoprotein, play a crucial role in limiting the entry of xenobiotics into the CNS. These transporters actively pump drugs out of endothelial cells back into the systemic circulation. Understanding the interplay between efflux transporters and drug pharmacokinetics is essential for optimizing drug delivery to the CNS and overcoming multi-drug resistance. Nanotechnology offers novel strategies for delivering drugs across the BBB. Nanoparticles engineered to encapsulate therapeutic agents can exploit receptor-mediated endocytosis and transcytosis mechanisms to cross the BBB. These targeted drug delivery systems hold immense potential for specific and efficient drug delivery to treat neurological disorders. The disruption of BBB integrity is a common feature of several neurological disorders, including stroke, multiple sclerosis, and Alzheimer's disease. Understanding the consequences of BBB breakdown, such as increased inflammation and altered drug delivery, is crucial for developing therapeutic interventions that target BBB repair and enhance drug efficacy. Accurately visualizing the BBB and its functionality is vital for diagnosis, monitoring treatment efficacy, and drug development. Various imaging techniques, such as MRI and PET, provide insights into BBB permeability and transport mechanisms. However, challenges persist in accurately quantifying BBB permeability due to its complex nature and differences across brain regions. Drug metabolism in the CNS significantly influences drug efficacy and safety. Unlike in the liver, the metabolic capacity of the brain is limited, requiring consideration of drug metabolism when designing CNS active drugs. Moreover, enzyme induction in the CNS can affect drug metabolism and alter drug concentrations, highlighting the importance of understanding these processes in clinical practice. Astrocytes, the most abundant glial cells in the CNS, play a pivotal role in BBB maintenance. They provide structural and metabolic support to endothelial cells, contributing to the formation and integrity of the BBB. Dysfunction of astrocytes can lead to BBB disruption and compromise CNS homeostasis. Unveiling the intricate interactions between astrocytes and the BBB is essential for advancing our understanding of neurological disorders. The BBB poses a significant challenge in delivering therapeutic agents to brain tumors. Targeted drug delivery approaches aim to exploit specific properties of brain tumor vasculature or use cell-penetrating peptides to enhance drug transport across the BBB. These strategies provide promising avenues for improving the treatment outcomes of brain tumors and reducing systemic side effects. Pharmacogenomics examines how genetic variations influence drug response. Individual genetic variations can affect drug transport across the BBB and alter drug concentrations in the CNS. Understanding the impact of pharmacogenomics on BBB drug transport can contribute to personalized medicine strategies and optimize drug therapy in patients with neurological disorders. The unique properties of the BBB can also contribute to adverse drug reactions specific to the CNS. Drug-induced neurotoxicity and neurocognitive effects may occur due to drug interactions at the BBB or drug-induced alterations in BBB transport systems. Recognizing these safety concerns is critical for evaluating the risk-to-benefit ratio and ensuring patient safety. In conclusion, understanding the intricate mechanisms of BBB transport, its role in neurological disorders, and the challenges associated with CNS drug delivery is crucial for developing effective therapeutic interventions. Advancements in nanotechnology, imaging techniques, and pharmacogenomics offer exciting prospects for improving drug delivery to the brain and enhancing patient outcomes. As future healthcare providers, your knowledge of BBB pharmacology will be invaluable in providing optimal care to patients with CNS disorders. Keep exploring the wonders of pharmacology and the intricacies of drug transport to make a difference in patients' lives.